best exercises to improve pelvic floor health are not necessarily all physical exercises. Some of them are awareness exercises that I wanted to bring to your attention. Hi, I'm Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. In this video, I'll tell you all about the things that I share with my patients when it comes to pelvic floor dysfunction and pelvic instability, leading to many of the symptoms that are related to this dysfunction. A lot of times people go to pelvic floor physical therapists and most of the work is done internally. And here I am telling you that this is not how I approach it from the angle that I see. So make sure you subscribe to the channel, make sure you turn that notification bell on, and make sure you comment below. I actually do look at these comments and try to answer them if I can. So the first thing you want to do is breathing. Breathing is the #1 tool that nature uses to relax the muscles inside of your pelvis and also practice the same muscles working together. That's the key, working together to help you breathe out. So when you're breathing biologically, you have a circumferential expansion of your trunk. Your trunk is the part of your body that's covered by a gymnastic leotard. So when you have a circumferential expansion, that means everything on your side of your trunk expands outward. Do not concentrate on pushing your tummy out in a belly breathing practice, because most often people are so busy pushing this out, there's hardly any air pushing the sides out, and sometimes that aggressive pushing the tummy out actually lifts your back into that position, which is not what we want to do. So in the practice of biological breathing, it's best to laying down on the floor. You can do it seated, and I'm going to go ahead and sit down on the floor to show you. You want to sit on your sit bones. So find your sit bones and sit on it like where your hand is. Sit just straight on top of it. Place your hands in the waist area with your thumb going towards the outside of the side. So we're talking about right about there. So as you're breathing in through your nose, your lungs fill up. They push on this dome-shaped diaphragm, and this diaphragm pushes the floating ribs on the side of your rib cage outward and makes this whole area expand outward. So when that happens, where you place your fingers in the waist area, just like I showed you, you feel that pressure from inside pressing against your fingertips. Remember, this is breathing. Not every breath is deep breathing or forced breathing. When you concentrate on pushing your sides out, you will not bear down and you will not cause issues. So it's a slow, relaxed breathing in, pushing your sides out. And then when it's time to breathe out, you reverse the process. Biological breathing is 100% my most favorite exercise, the most effective exercise long term, and the one that if I was told I could only do one exercise in my whole life, that would be the one I'd pick. The next exercise is what I think I came up with it myself. I'm not 100% sure anymore, but it's what I call scissor on the wall. What I've noticed is with patients with pelvic floor dysfunction, there is hyperactivity of the inner thigh. The inner thighs are used a lot and their feet are not engaging enough. What I suggest you do is go all the way to this to the back of the wall. This is a good position for for the camera. You're going to bring your butt all the way to the wall and place the sides of your feet against the floor. They don't have to be touching each other. If your inner thigh is just stretching too much, bring your feet up a little bit. So mine is not feeling, so I'm going to bring it down here. I suggest for the small of your back to be on the floor and just gently press the edges of your feet to the wall to see the activation of the outer part of your lower extremity. Your hands are placed on your knees or close to the knees, not pushing your knees away or pushing your knees up, but to simply cue your brain to not let the knees come in or just drop and not be active. So it's just that little bit of a gentle pressing on the outside and upward that's happening right here. My lower back, that's the key, not the glute. Like my lower ab will try to lift me up. So this whole time, pretend you're farting. That means you're relaxing your perineum. You're farting through your anus. You're farting through your perineum. You're farting through your penis or vagina. I know you can't fart through all of those, but pretend that's what you're doing so you're not engaging your perineum. Your back is lifting you up, and now you just hold it there. This is when we're practicing the inner thigh to not come in, the outer lower extremity to engage, and for your back to work with your ab, lower portion of your trunk, to hold this pose as you're breathing biologically. When it's time to come down, you slowly bring yourself down and make sure the lower back does not arch up. This is once again a practice of every part involved in the movement to do its part instead of having to pick up another part's job. Finally, the exercise that I want to bring to your attention is the mindfulness exercise. Here, you want to remember to pay attention to some of the principles that need to be in place. This is your hip joint. This is a ball and socket joint. So we want to have the balls. Let me grab this. So you want to have the ball of your hip joint to line up with the bump on the outside of your ankle. So this is all lining up like so. So you're not in front of it or behind it. So it's ball over bump. Your neck is over your crotch. So that means you're not this way. Do you see how the ball is still over the bump, but I'm slouched? So it needs to not, you need to not allow this pelvis to, or your tailbone to tuck under you. Now, the shoulder blades are essentially laying nice and flat on your back so they're not rolled forward. If you're wondering how this is related to your pelvic health, the position of your neck directly impacts the position of your pelvis. If your neck is forward, your pelvis has to adjust itself for better center of gravity. So everything is related. The moment your pelvis is not in its ideal place, but it has to change its position for almost permanent modification of where it should have been, the muscles inside of your pelvis start behaving differently because you no longer have a nice neutral pelvis. The muscles inside have to work with the muscles outside to stabilize your pelvis. When that doesn't happen, they need to get tighter. and they stay tighter. And tighter over time can translate into so many different signs and symptoms that you're suffering from. So the fix is not to go inside your pelvis through the vagina and or anus to try to access it. Not in my opinion. In my opinion, I want to take away the reason why it got tight to begin with. So by studying stability and biomechanics of pelvis, I can see the state of the inside. I don't have to do anorectal manometry to know, or arm test, to know if those muscles are tight, what the pressure is. It's obvious what it is. How is that going to solve the problem? The problem, once the source of the problem and what feeds the problem is removed, now we have a chance. So the way you want to address this is to understand it is your responsibility to understand how this body needs to be. This is like planting a seed and taking care of it to grow. Just because you bought a seed doesn't mean it's going to become a plant. You got to nourish it, you got to nurture it, you got to take care of it. That's the truth about your body. When we look at outside resources for things that we're responsible for, the solution is not going to be in your own hands. So take the time to understand what healthy is. You don't need to become major in physiology and biomechanics to know it. This is like driving a car. You don't need to be a race car driver. You don't need to be a manufacturer. You just need to know how to drive a car. Once you learn it, you can drive your car anytime you want to. Any place, any kind of car. Same is true with your body. So I hope that this made sense. I hope to get your comments below, and I hope you share this video with other people who may or may not have pelvic floor dysfunction symptoms at the level that they're thinking they need to do something about. Thanks for watching.